Your physician will talk to you about the specific type of tumor that your child has, and that may be still waiting for specific tests that may be coming through. And based on that, we'll talk about different types of treatment that your child will have to undergo, which again may have a different combination of surgery, chemotherapy, and radiation. And during that time, we'll talk to you specifically about your child's cancer, to what their prognosis is, how long chemotherapy will be, how long will this last, how often will you have to come to the office, will this chemotherapy be given in the inpatient setting, will this chemotherapy be given in the outpatient setting, and all this will be discussed with you at that time. Have no fear, most people will have questions thereafter, and we'll have this discussion over and over and over as many times as you need. And if there are any questions that you may have, you may ask them more than once to make you feel comfortable.
Right.
Expect for to have deep, long discussions with your physician. We'll be coming to discuss with you what the diagnosis is, and that'll be based on numerous different things. A number of different things, including imaging, different blood tests that we might have had, and we'll discuss all of those test results with you. Once we determine the specific type of cancer you have, or whatever form of disease you have, then we'll discuss the various modes of treatment, which may include chemotherapy, or surgery, or radiation, and many times a combination of the three. We'll discuss the timing of this and any special needs that you may have, including to work around your schedule. Sometimes we're not going to be able to work around certain schedules, but for the most part we try to work with you. Many chemotherapies are unable to be given through a peripheral IV, so a surgeon is usually consulted to place a central line in there so that the chemotherapy can be placed safely into the veins. Some of them rest underneath the skin, some of them have lines that are hanging out, and each of those have different benefits, risks and benefits, for which our physicians will talk to you about in detail.